Right, so privatisation of the NHS, the Americanisation of it, is happening and it isn't getting talked about by our mainstream media. But MP Claudia Webbe has raised the issue because it's all happening under the guise of so-called integrated care services, or ICSs. We won't let it happen, many will cry. If they try to take our NHS from us, we'll take up torches and pitchforks and go to war to save it. But of course, the NHS is never going to be blatantly privatised. You're never going to be getting a right-wing MP of one party or another saying, oh, we can't afford that, it's got to go. Not when it stood for more than 75 years proving the complete opposite. Factually, with our rancid mainstream media to rely on in most cases, would you even know it was happening? It'll be done a little bit at a time. It'll get done with a change in policy here, a removal of funding there, and before you know it, you're seeing beds disappearing, wards closing, massive queues of ambulances with patients waiting to offload if they're lucky enough to be seen by an ambulance and make it there at all. As we know, patients are dying in need of medical help that never arrives in time. But of course, we're seeing all of that now, aren't we? 40 new hospitals, I remember someone saying, I should cocoa. Tory cuts, the burden placed upon a shrinking workforce where there are too many vacancies due to the increasing unattractiveness of the profession, is killing the NHS. But the Tories have come in and suggested reforms, of course, as ever. Those words should terrify us all, Tory reforms. But for many, they hear instead efforts to improve our health service, when the opposite is true. It's that belief that having an NHS will always be a priority for whoever is in charge, it will always be a policy, that I fear has made people complacent regarding the health service. So we need to sit up and take note of what they're up to. And it's these integrated care services, these ICSs, we need to not embrace, but condemn and actually fear. The term ICS is actually a rebranding. Integrated care services are the new accountable care organisations, ACOs. This is what they were formerly known as, but that was a bit too obvious, a bit eyebrow raising, a bit on the nose, because that's exactly what the Americans call their health service providers. And if private health and their cheerleaders to get their way with scamming us out of our NHS, then they can't have it being compared to the US health system, one of the worst, most expensive in the world, and we as a public know that. But that is exactly what our politicians are embracing here. As I said before, it's all happening by stealth, covertly. They are copying that system, that US system, bringing it here, and nobody is coming out and saying it, save MPs like Claudia Webbe has done, who has written an excellent article on all of this in the Morning Star. Our NHS is being taken away from us, despite 89% of the public wanting the old NHS that looked after us properly back. According to an Ipsos Mori poll published just a week ago, our politicians are refusing to heed any of that, making a political choice to not do that. People might sneer at Webb's choice of publication, but we're talking 89% of the populace here, according to this poll. They're hardly all going to be raging lefties, are they? And frankly, if the Star is prepared to tell you the truth when more mainstream, more acceptable to your mind, perhaps, publications are not, who are the more extreme here? The paper publishing what is actually happening, or the ones intentionally hiding it? Accountable care organisations were rolled out in the US under Richard Nixon, who was told by those selling him the idea that all the incentives are towards less medical care because the less they, the health companies, give them, the more money they make. I don't know about you, but profiting from the ill health of others makes me feel ill. Yet it's been the underpinning ethos of American healthcare for over 50 years now. And it's been creeping in here in the UK for at least the last 30 years, unbeknownst to most people, unnoticed perhaps, showing this isn't just right-wing Tories now that have been up to no good with our healthcare, but the Labour governments that came before it as well. Now, as I said before, the moment ACOs got mentioned here, people twigged to what was going on, but the plan never went away. It just got rebranded as ICSs instead and has carried on regardless. Now, if you look at the NHS website, you'll see integrated care services described as partnerships of organisations that come together to plan and deliver joined up care and public services to improve the lives of people who live and work in their area. Their area is pertinent as far as the terminology and that goes, because our NHS got broken up last year under the Health and Care Act of 2022, which changed one NHS into 42 ICSs from last July. You can immediately see the problem with this, as you know how funding won't be divvied out evenly across them all. Some areas will profit more than others, almost certainly along political lines, as everything else seems to get. And of course, profit is the name of the game here. Regardless of what the NHS website says, what is actually happening is private companies, as the person who sold the idea to Nixon put it, to provide less and make more money. Our services are being reduced, The waits are getting longer because the investment is being taken away. It's being cut. What is incentivizing the private healthcare companies to do this is how they end up making their money. They reduce the cost of UK healthcare and then take a bit of the budget for themselves as a reward for saving the government money and reducing the overall budget. They aren't getting rewarded for providing healthcare services. They're getting rewarded for shutting them down instead, effectively. The more money they can save from their allocated healthcare budgets, the more profit they can make for themselves. So how are they incentivized to provide outstanding world-class treatment? It's cash for cuts. It should be a raging scandal, but it's not. The end result is obvious, of course, a healthcare service that will end up failing, death by 1,000 cuts, and what then? Insurance-based healthcare, here we come? The private healthcare sector is already being hailed as the answer to the crises in the NHS, but it's actually causing them behind the scenes. And if you think private health provision have the capacity to replace losses in the NHS as some are crowing, think again. Of course, some politicians have been making this direction of travel for UK healthcare slightly obvious and have been slammed for it publicly. The scandal of it all, as it has been when presented to us, as all the media should be, about everything else I've spoken about here so far. Matt Hancock's crony contracts for private health, the sheer sums of money thrown at the pandemic and wasted as various entities failed to deliver. Though the one silver lining from his actions was to show how much damage can be caused and how quickly to healthcare budgets and services when you award contracts to the wrong people, and all of them made their cut bigger out of the budgets they got by cutting corners. They made more money the more cheaply they could source goods, with all the failed PPE, the failed trust and trace. The list goes on to prove that. These companies didn't seek these contracts to deliver a swift end to the pandemic. There was no altruism, no sense of a greater good at work here. They saw an opportunity to cash in, and we saw what happened as a result of that with one of the worst pandemic responses globally. What it delivered was subpar PPE, public money wasted in the billions, lost to fraud, and all the cases and fatalities that such greed-driven incompetence created. Now imagine this on an NHS-wide scale. They haven't learned lessons from any of that. They've simply learned they need to cover their tracks better. This is what we're talking about here. But very few people are, and never in the mainstream media. You have the Tories, who are still driving this mentality, and you have what is likely the next government in waiting, in the likes of Keir Starmer and Wes Streeting, taking donations from private healthcare and saying they will not now reverse the privatisation that has already happened in the NHS, but continue to build on it and embrace it instead. Therefore, how are they any different to what we have now? They've sold out their own party's greatest achievement. Starmer plays this down. He claims Labour's greatest achievement was NATO. But it has always been the NHS. It always will be the NHS at this rate. And it's no more safe in a red Tory's hands than it is in a blue Tory's hands. Here's the thing with private healthcare, though. These companies always want more, bigger profits, bigger bottom lines. So the NHS budget increases anyway, but the services keep declining as they keep cutting from their budgets to keep on making bigger profits. The government can then say, well, we're putting more money in than ever before, but functionally, all that is happening is private healthcare companies are having their pockets lined by ever greater amounts. It's not even just the politicians in on it either. The editor of Health Service Journal, so often quoted by the media as an authoritative source on the goings-on in the NHS, a chap called Alistair McClellan is their editor, who describes his publication as the #1 source for NHS news, has developed a tool called HSJ Intelligence, apparently some kind of an AI tool for marketing in the NHS, offering insight into what the best parts of the NHS for private companies, private sector suppliers are, to identify where the best opportunities for them lie within the NHS. It literally helps private companies get NHS contracts. We've seen the damage the Tory VIP lane created. I've touched on it already. Yet here we have a trusted authoritative source on all things NHS, showing companies how to carry on with that and even do so more efficiently. To try and debunk such things, he calls on others already involved in NHS privatisation to do so. The privateers are always the loudest voices denying what is there in black and white if you look hard enough. And sadly, looking hard is what people are having to do to see the truth of this situation. 42 ICSs instead of one NHS. You might as well call them 42 detonators ready to trigger explosions within the NHS. We still get it free at point of use, of course, but the reality is it's costing us all more and more, and we're factually paying for its destruction, along with fewer services, less competence, harder access to it, all whilst making private health providers even wealthier off the back of all of it. If you're the torch and pitchfork type regarding healthcare, you should already be in the street over this. And ICS is RIP to the NHS. Thanks for watching. If you enjoyed this video, please do hit like and subscribe, leave a comment and hit the notification bell too so you don't miss the next one. Also look out for me on social media and other interesting stuff by clicking on the Linktree link in the comments below, and I'll see you next time. Cheers, folks.